Good afternoon, Rhode Island. Good afternoon to the members of the press. Thank you for tuning in today on a Monday. I want you to know that today is our 101st COVID press conference. So I know there are many of you who have not missed one of these, and I want to thank you for tuning in. So this is our 101st COVID press conference, and I hope you have found them useful. And I hope you continue to tune in as we go forward. Now, I know everybody's used to watching this on a Wednesday. Today, obviously, we're here on a Monday, so I want to thank you for tuning in today on a Monday. I also want to give you a heads up about something different we're going to be doing next week. So next week, I'm going to have a press conference every single day at 1 o'clock. Next Monday, it'll be the full-length press conference at 1 o'clock, similar to the one that we're about to have now, where I'll touch on a variety of different topics related to the coronavirus. But every other day next week at 1 o'clock, we're going to be having a short 15-minute live press conference just to talk about K through 12 public school reopening. This is a Herculean effort to get our kids back to school safely, and were many questions. So we decided next week, every single day, 1 o'clock press conference, and Tuesday through Friday, it'll just relate to public schools. I do want to say thank you to members of the media and to the press outlets who are agreeing to take the press conference live and cover it every single day. I appreciate that. You're doing your part in the crisis, and I appreciate your willingness to let us go ahead and do that. Okay, so I have a lot of news today. Bear with me. This is a number of things we have to go over. We begin, as we always do, with a look at the data, and I'd ask you to please put the data on the screen. It's a good news story with today's data, and I want to thank the people of Rhode Island for sticking with it, staying at it, wearing your masks, and following the rules. Yesterday, we had 39 new cases, but even more important than the number of cases, we had a percent positive of 1.1%. That's excellent. That's just where, 1.1% is, that should make you feel confident that we're doing things well here in Rhode Island. 39 cases is a low number. However, even more important, we're testing more and more people. And you're going to start to see the number of folks that we test really ramp up in the coming months as school starts. So we want to keep our eye on that percent positive, which is 1.1%. Yesterday, I have no new deaths to report from yesterday, thank God. But unfortunately, we lost 5 Rhode Islanders over the weekend. So just take a moment to keep those folks in your thoughts. That every day, almost, we continue to lose Rhode Islanders to this horrible disease. And our hearts and thoughts and prayers go out to those who lost a loved one over the weekend. As you can see from the rest of the data on your screen, the case numbers and very importantly, the hospitalizations have remained steady. And also the percent positive, very low at 1.1%. I want you to know it's been below 3% every day since we started phase 3. So by and large, it's, as I say, it's a pretty good news story. I'm asked frequently, Governor, should we be reopening slower, faster? And the truth of it is, it's a judgment call, and it's a balance. It is a balance between keeping everyone safe and keeping a lid on the virus, but also letting folks get back to work. Right now, at this point, we still have over 100,000 people on unemployment insurance. And recently, I've been asked, are we getting the balance right? Should, Massachusetts, Connecticut, New York, they have held back on their economic reopening a little more than we have. I have made the decisions I've made to strike that balance. And a new analysis today, actually, by CNN and Moody's ranks Rhode Island's economy as the 6th best in the country on what they call the back to normal index, getting back to our normal economy. So from April to July, we saw a 7% decrease in our unemployment rate, putting us at the 10th best in America. So I would say this, there's no perfect. Everything is, I'm doing the best with my decisions. But today, as I come before you for our 101st press conference, we are reporting, among the best states in America, top 10, for getting our economy back to where it was, and also a percent positive rate of 1.1%. So as we evaluate how we're doing with coronavirus, it's a terrible thing. We have 100,000 people out of work, restaurants and shops hanging on by a thread, and my heart goes out to all of you, and we're working to get you back to work. But relative to a lot of other states, I think we're holding our own pretty well, and I want to thank everybody for doing that. The best thing we can do to get people back to work and reopen our economy even more is to do what we've been doing. Wear your mask, wash your hands, don't go out of your house ever if you're sick, social distance as much as you can, social gatherings, 15. By the way, I know that's hard. I had to host a family gathering over the weekend. Normally we would have 20 more people in our house, 14 people. So we're in it together, and I'm asking you, please keep following the rules, because we want to keep people out of the hospital, and we want to get folks back to work and kids back to school. So this is where we are 6 months into living this together. Okay, I want to start briefly with an update on what we saw at Rhode Island's businesses over the past week. I usually like to do that on the Monday. As an update for you, last week we conducted more than 1,100 inspections. If you see someone who works for the Department of Business Regulations, say thank you, or the Department of Health. These guys are working so hard. We have a small staff, over 1,000 inspections. It's another record high, another record of how many places we've inspected. Good news. Employee and customer mask compliance remained around 95%. Good job. And capacity restrictions at all the retail and restaurants we visited remained at 98%. That's great news. We are going to be able to continue to keep our shops and restaurants open if you guys continue to follow the rules at 95 and 98%. We saw 13% of restaurants and bars without proper separation between bartenders and customers. That continues to be a problem. And 6% with crowding at the bar area. Now, I will say that is improvement. That's the best data we've ever had. 6% and 13% is the lowest non-compliance we've had, so thank you to bar owners and restaurant owners. It's still not where we want to be. You have to try a little harder to cut down on the crowds and keep distance between the bartender, or more than distance, a plexiglass between the bartender and the servers. We also saw 98% compliance with bars closing at 11 o'clock. So I want to thank you for that. I know that's tough, but it's working. It's reflected in our numbers. These steps are working, so I want to thank you all for your continued cooperation. I want to spend a few minutes now talking about school. Will we reopen schools? The top of everybody's mind right now. And look, this is important. We have an entire generation of young people who are depending on us to get this right, to help them get the education they deserve. And so we are very focused on it. I have a few announcements related to where we are. I want to begin by complimenting the National Guard for the role that they have played in the coronavirus pandemic, being front and center in our response from day one. We were the first state in America to deploy our Guard to do drive-through testing centers. We've deployed the Guard to go into nursing homes and congregate care settings to provide support. They've helped us with contact tracing. Under General Callahan's fantastic and exemplary leadership, the Rhode Island National Guard has risen to the challenge over and over again. And I want to thank the General for his leadership and commitment. I don't think he's had a day off from the beginning, and I want to thank every member of the Guard who's helped us. Of course, the reward for fantastic work is more work, so we are, again, going to be relying on them to help us open schools safely and make sure that our facilities are ready when it's time to open school. So to that end, I am announcing now that we are launching, effective today, a Education Operations Center. This Education Operations Center is going to operate very much like the EOC that we stand up during a hurricane or a blizzard or some other kind of natural disaster. It's going to be staffed by folks across state agencies, including the National Guard. It'll have National Guard, RIDE, which is the Department of Education, the Department of Health, the Department of Transportation, RIPTA, and the EMA. So this will be 24/7 operation, entirely focused on providing real-time support to our schools, drawing upon the operational, logistics, and transportation expertise of the Rhode Island National Guard. So this, we've been spending a lot of time with parents, teachers, teachers union leaders, principals, superintendents. Everybody wants to do the right thing. Everybody wants to get the kids back in school. The question is, how do we do it? And the answer is, it's just a lot of hard work, a lot of logistical planning, transportation planning, laying out the classroom differently. And so today I want you to know we're there for you. You're not on your own in the school districts. And that's why, as of effective today, we're standing up an Emergency Operations Center. We're calling it the EDOC, just related to K through 12 education. I want to spend a minute now talking about what our school districts are responsible for versus what the state will provide. I think this is important for folks to know, it's important for parents to realize, and frankly, it's important for the school districts to know. So I'd ask you please to put up the slide that we've prepared that explains the role of the state and the role of the local districts. The slide before you is intended to illustrate the unified and, I think, innovative approach that we're taking here in Rhode Island, both to getting schools open safely and providing support to the school districts once they've opened. On the left-hand side of the slide in front of you, you see the responsibilities of your school district. First and foremost, the job of every school leader, every principal, every superintendent, is to provide high-quality learning experiences for their kids, for their students. So in order to ensure that they can do so safely, they're also responsible for immediately isolating symptomatic students, immediately reporting probable cases through the new Department of Health school reporting portal, assisting the Department of Health with contact tracing and case investigation, implementing all required health and cleaning protocols, providing safe transportation based on our state guidance and with the support of the National Guard, maintaining supplies of personal protective equipment and sanitation equipment. And the local school districts are also responsible for establishing clear and frequent processes for communicating with the Department of Education, the Department of Health, and their entire school community. It's a heavy lift. Superintendents have a lot to do. We're calling on you to step up as leaders, same with principals, and by and large, you're doing a terrific job and working hard, and I want to thank you for your leadership. On the right-hand side of that slide is the list of supports that it's offered by the state and state agencies through our EDOC. The Department of Health is going to be providing ongoing public health guidance to schools, in addition to overseeing case investigation, contact tracing, and testing operations for all staff and students. They'll also be leading ongoing on-site facility assessments for school buildings, and I'm going to talk about that more in a second. So I want to pause and make this clear. because this is different in Rhode Island than I think in pretty much every other state in the country. We, the state, are going to undertake the responsibility of providing testing, contact tracing, case investigation for all the schools and all the school districts. We're a small state, we don't really have a county form of government, and we felt that was the right thing to do. If you're a parent or a teacher and you're listening to this, I hope it gives you some sense of confidence that the state, you know, we've learned how to do testing. We've learned how to do contact tracing and case investigation. So we're going to handle this for your school in communication with the school, and I hope you have some confidence knowing that that's the way it will be handled. The Department of Education will be providing operating guidance and instructional support with a focus on learning outcomes, ensuring that every school has the best possible in-person and distance learning platforms, and they'll be communicating constantly with school leaders. And I want to thank the commissioner and applaud her and her team at RIDE for doing a fantastic job helping to get the facilities ready, but also doing what they do best, which is helping us to deliver high-quality education to our students. And then our other state partners will be providing on-the-ground assistance teams, contingency supplies, and planning and logistics support. So what is that going to look like? The Operations Center will be ready and able to assist with anything that the school needs on an ongoing basis. What's that mean? If a school's running low on hand sanitizer or masks, that team will immediately arrange for the supplies that are needed. If a school's struggling with logistics and needs logistical support to ensure strong in-person learning, the team will be there to provide that assistance. When you have a student or a staff member who tests positive, which is going to happen, that will happen, and we're prepared for it, this team from the Operations Center will be on the ground at the school as quickly as possible to test, isolate, quarantine, and do everything we know how to do to prevent a large outbreak so that we limit the interruption to in-person learning. This Education Operations Center is activated as of today, and by next week, every school district will have a designated single point of contact at the Operations Center and will ensure a frequent line of communication between the districts and the Operations Center, as is illustrated on the slide. The Education Operations Center will ramp up over the next few weeks with the recognition of several milestones, including the return of teachers on September 9th and the return of students on September 14th. Once the schools are open after the 14th, the leaders at the Education Operations Center will be prepared to deploy assistance teams to any school in any city or town on a moment's notice. We've learned over the past 6 months how to do this. When there was an outbreak at a nursing home, an outbreak in the prison system, we've learned how to deploy teams quickly and support teams, and so we're going to take all of the learnings and the innovation and do the same exact thing, what we've done there, for schools. So the message with this Operations Center is, if you're a principal or superintendent, yes, it's true, you're the front line, you have the primary responsibility, but we are right there with you. And a phone call away to provide the backup you need so that you'll be able to be successful. I want to talk for a second about the Department of Health's role in all of this, a question I get frequently. In mid-June, a couple of months ago, the Department of Education and the Department of Health released guidance to every school district on developing plans that meet all the health requirements for in-person learning. It was a detailed 34-page document, and it outlined, if you haven't checked it out, I would recommend that you do it. Now that we're thinking schools closer, so it's more top of mind. It's a 34-page document. It outlines everything from class size limits, screenings, schedules, visitor policies, transportation, school activities, etc. It's currently available, as it has been, at the number 2, backtoschoolri.com. Every single school district, as of now, has prepared an integrated COVID-resilient reopening plan based on these guidelines that addresses the health and safety of all students, including social, emotional, and mental health. Every plan was submitted to RIDE, and every plan has been thoroughly reviewed by RIDE and RIDO with a focus on the district's ability to deliver effective education outcomes in compliance with the Department of Health standards. But putting safety plans in place is just one step. You can put something on paper. We have to make sure it's actually implemented on the ground. And this is hard stuff. It's easier to write it. It's hard to write on paper, but it's easier to write on paper than it is to actually operationalize it every day, day after day. So with this in mind, I have established a facilities readiness team with the sole purpose of walking through every single public school to assess their compliance with the Department of Health's facilities guidelines, all prior to any student entering those facilities for the first time. As far as I know, we're the only state in the country doing this and making this commitment to our teachers and to our students for their safety. This isn't my idea. I've heard this. I have spent many hours in the past couple of weeks listening to teachers, parents, union leaders, principals, superintendents, charter school leaders, and I hear the same thing. Asking, please, could we have someone from RIDO, from the Guard, from the team, go through the facility to make sure that the facility is ready to accept students and that the facility looks like what the plan says it should look like. So today I'm pledging you that that will happen. Before any students and teachers steps foot to begin school on the 14th, every facility will have had a walkthrough to make sure that it is ready to accept students. Department of Health has developed a detailed 13-page guidance document that covers every element of a safe school. Classroom layout, hallway layout, cleaning, ventilation, air circulation, availability of isolation space, and on. That document, that 13-page document, is going to be posted today, by the end of the day, at backtoschoolri.com. So you can feel free to look at that. If you're a parent or a teacher, I'd recommend you look at it. No one should have to go to school or go to work in a school and feel unsafe. So we're doing everything we know how to do to make you safe and make you feel safe, which is what you deserve. So check out this 13-page document, and that's the document that the inspectors will use to make sure that the school is ready. Additionally, over the weekend, we've also engaged a nationally recognized air quality expert who will be participating in the walkthroughs to ensure that schools have taken appropriate precautions to circulate the air. Finally, and additionally, this isn't going to stop once the doors open. That team, I'm going to keep it in place throughout the school year, and they're going to do continuous and unannounced on-site inspections and audits, similar to what we do with restaurants, to make sure that throughout the year, the schools are doing what they're supposed to do in order to keep students and teachers safe. And by the way, we're doing it together. This isn't about, we're going to have the audits, we're going to have the inspectors go in, but it's not a gotcha, because we're also going to have our operations center and support teams available. So if you're not in compliance, we're going to help you get into compliance. This is an enormous amount of work, and I have to thank my team. It's been a very long weekend, and I feel great. I mean, a long 6 months, but we finalized it all over the weekend, and we're ready. You know, our pledge to you, there's going to be bumps in the road. We're going to have, kids are going to get sick. There are going to be outbreaks. The first month of school, everyone has to be patient and innovative and thoughtful. But as I've surveyed what other cities and states are doing, I believe this to be, if not the most comprehensive, among the most comprehensive It's all designed to do right by our teachers and to do right by our students, so that you can be in a school, which is where kids learn best, and be safe. And by the way, we're going to learn a lot. You know, we're going to be good on September 14th. We're going to be a whole lot better on October 14th and November 14th. But my commitment to you, this is a lot of resources, and the state is doing this work to make sure that you're safe and you feel safe when you step in, that your buildings have been inspected. A quick note about private schools, parochial schools, religious schools. Next Monday, a week from today, we'll be making our school reopening decision, and I'll be announcing that based on where we are at that time with regard to the data and our ability to provide testing and other operational supports. So that's next Monday. Tune in for that announcement. I'll go through the 5 metrics and make a final announcement about school. In the meantime, I've been asked about guidance for non-public schools, Catholic schools, private schools, other religious schools. I want to make 2 announcements now about the private schools. First of all, the state intends to provide all schools, including non-public schools, with the same testing, contact tracing, and case investigation supports. So all schools, public and private, are going to receive from the state the same level of testing, contact tracing, and case investigation. It's in it's in the state's public health interest for this to happen. The precise details of what that system will look like will be online this Wednesday. So end of day Wednesday, we'll put online exactly how the state is going to be operationalizing testing, contact tracing, and case investigation, and what that says applies to all schools, public and private. That'll be at backtoschoolri.com. Second thing I want to announce is private schools and parochial schools, religious schools, non-public schools, who are ready are allowed to open prior to September 14th. It's a question we've been getting frequently. So all of these schools have been developing their own safety plans and have been in close contact with the Department of Health and the Department of Education. Many of them are very anxious to bring students back before the 14th. So as long as your plans have been reviewed and you're ready to get back before the 14th, you are allowed to do that. You don't have to wait for the state's September 14th deadline. You do, however, have to wait until next Monday on the 31st, which is when I'll be announcing if you can go back in person. And hopefully that clears up some confusion. We've been in contact with private schools across the state. You've done a terrific job developing plans to bring your students back. As I understand it, most of you plan to bring all of your students back in person, which we think is terrific, and you are allowed to do that prior to September 14th if you're ready. Okay, I want to talk for a second about what does it mean to be safe? You know, you hear a lot, you hear it all the time, every day. I want to send the kids back to school if it's safe. And I think that is a term, of course, absolutely. And as I've just spent a few minutes outlining, we're going to make the buildings ready, we'll have the air quality ready, we're going to have testing, contact tracing to make sure the kids are safe and the teachers are safe. But last week, there are many things that go into safe. What is safe for a student? And certainly safe is reducing the risk of anybody contracting coronavirus. Can never be risk-free, but reducing that risk, doing everything we know how to do. But there's something else that goes into safe, which is making sure our children are physically, emotionally, intellectually, mentally safe. And I have to say, the stories of the way our children have struggled in the past 6 months with distance learning are truly heartbreaking. And as your governor, I am of the view that it's not always safe for kids to stay home. Because we've heard from children and parents and health professionals that kids are suffering and it isn't safe. Last Thursday, I was joined on my weekly Facebook Live forum by 2 mental health professionals from Bradley Hospital. And I was quite struck by what they said. They said, quote, parents are seeing new symptoms in their kids, new symptoms of severe depression, isolation, and deep sadness. And, quote, these are things their kids have never before displayed. They also noted a significant increase in calls to their Kids Link hotline about anxiety and self-harm, including suicide. And they expressed concern about continuing to see a spike in those calls with the continuation of distance learning. By the way, I want to thank Dr. Jenks and her colleague Barbara Austin for joining me, and I want to thank the folks at Bradley for being just phenomenal throughout this crisis. I know you're overwhelmed. You're doing a terrific job. Kids Link is saving lives, and I want to thank you. These struggles are also reflected in the data, as well as communication that the commissioner receives. So NWEA, which is a national education nonprofit, estimates that students participating in fully remote learning can retain about 70% of their reading comprehension as compared to in-person learning, and about 50% of their math. On top of the data, we hear it. We hear the stories, and the commissioner hears the stories. We hear from families that distance learning, quote unquote, just didn't work for my family. And by the way, it's everywhere. It's not just, people say, oh, that's just what's happening in the inner city. That's not true. A family in East Greenwich said, my son, who's always been a star student, essentially, quote unquote, checked out during distance learning and fell behind. A family in Lincoln said distance learning was, quote, just not working. And by the way, I want to say this. Lincoln, East Greenwich, Providence, everywhere, all the teachers and administrators gave it their all. This is by no means a criticism of what they did. They tried hard, Herculean efforts to turn on a dime and deliver distance learning. But the truth of it is absolutely not a substitute for in-person learning. And we're seeing it. So I ask you, is it safe? Is it safe to leave a kid at home, knowing depression, anxiety, isolation, suicidal thoughts is on the rise, knowing 911 calls for domestic violence are through the roof still, knowing many kids will be left home alone, trying to teach themselves on a computer? We owe it to this generation of children to do everything in our power to get them back in school. It will not be easy. It will not be perfect. We will make mistakes. But I am personally committed to do everything I know how to do and work as hard as I know how to work to get children in school and keep them and their teachers safe. No one deserves to feel afraid when they walk into work, and the same goes for teachers. But I'm calling on everybody, please pitch in every way you know how to help us get these children back in school. And by the way, if you're a parent and you're just not ready, fine, that's fine. That's your decision. We want you to have choice. If you have an underlying health condition, if your child does, if your child is challenged mentally, physically, fine. We value that. We respect your decision. Keep them home. And the learning, distance learning in the fall will be better than the spring because we've learned more. But if you want to send your children back to school, then I would encourage you to go ahead and do that. Another very concerning impact of distance learning, which leads me to the next point I want to make, was a dramatic decline in childhood immunizations. This is a problem. This is a problem that we have to continue to work on. This is going to be a real problem in the fall, in the winter, if we don't fix it. I've addressed it many times from this podium. The closure of doctors' offices the imposition of the stay-at-home order and the fact that kids weren't in school, seeing the school nurse, has led to a dramatic drop in childhood immunizations. I've talked about it over and over again. Childhood immunizations are not where they need to be. It's related to a lot of things, but also we used to run immunization clinics in schools. The kid would see a nurse, see a teacher, so it's all contributing. The pediatricians of Rhode Island have stepped up hugely, and I made some money available from our COVID relief fund. With the pediatricians, a couple months ago, we launched an aggressive campaign to turn that trend around. And by June, this is good news, we were only 8% below the previous year. So that's terrific. That's a dramatic improvement from when I was here in April and May. However, the reality is that only 75% of kids entering kindergarten this year will have all of their necessary immunizations. And it's about 50% for kids entering 7th grade. If you're a parent out there and you're hearing me and your children haven't been immunized, please pick up the phone right now and call your pediatrician or call a community health center. You need to get your kids immunized. And pediatricians are doing extra clinics, walk-through clinics, nights, weekends, extra hours. They're doing everything they can, but please pick up the phone right now if a child in your life has not been immunized. We're facing a virus for which we don't yet have a vaccine, so there's truly no reason that we shouldn't have every child immunized by the time they go back to school. So I'll leave it at that. Thank you to the pediatricians. Thank you to the community health clinics. Please get your kids immunized before they go back to school. Switching gears, 2 other quick announcements. I want to briefly address our cities and towns. I want to thank mayors and town managers for hanging in there through this crisis. You're doing a terrific job, and particularly recently, mayors have all put in extra effort to help us cut down on congregating and enforcing social gathering limits. I want to thank you for doing that. Every city and town, like the state, like most companies, is having a tough time with their budget. And next year will be a difficult budget year, no doubt about it. So on the one hand, and we want to do what we can to support cities and towns. Now, our cities and towns, in most other states, really nearly every other state, cities and towns have been responsible for testing, contact tracing. Many counties have their own departments of health. Most cities have, bigger cities have a department of health. They'll run a hospital or a county hospital. Thankfully, our cities and towns haven't had to shoulder any of that burden. The state has handled all of that for them, contact tracing, and therefore the state's bearing the cost of contact tracing, quarantining, testing, housing vulnerable populations, obviously all the hospitals. But all of that being said, even though they haven't had to bear those costs, it's hard for them. Cities and towns have seen their revenues really decline, which hurts the bottom line. My philosophy all along has been to use this crisis as an opportunity to innovate, to change the way we do business so that we can meet the needs of our population, even though we have to tighten our belt because our budgets are strained. And I've been having a great dialogue with a lot of town leaders around this, and we want to support them and help them. It's going to be hard to balance budgets. Money won't be there, so they have to get innovative. So in that spirit, today I'm announcing that at the request of the League of Cities and Towns, I'll be convening a Municipal Resilience Task Force. It's an 8-member task force. It'll include 4 municipal leaders selected by the League of Cities and Towns, 2 private sector leaders, and 2 budget and revenue officials representing the state. And together, that group will be tasked with developing recommendations for cities and towns on innovative strategies and tactics to prepare for a post-COVID future, or a during COVID and post-COVID future, where government can be responsive and effective and resilient, and also do so while saving money. The reality is we have to serve our citizens, budget is strained, so we're going to work together to be innovative to do both. It's going to include shared services, ideas around shared services, intergovernmental partnerships, and new technology. So I'm excited to support them, and I'm actually looking forward to seeing what we come up with. Go to any restaurant, it's amazing what they're doing. They are changing their business model to meet the needs of the challenge. They're getting creative. Every business is getting creative, and we are too in the state, and cities and towns are going to do the same, and we're going to help you do that. Last announcement relates to unemployment insurance. It's a brutal reality right now. If you have a job, you're lucky. I'm lucky. We are lucky if we have our jobs and we're getting paid. There are so many Rhode Islanders, over 100,000, who are still on unemployment insurance. So last week, I was asked about the FEMA Unemployment Assistance Program, and I want to provide an update on that. We've been in touch over the past handful of days with FEMA, and I have an announcement to make today. I'm pleased to share that we asked for and have received approval for funding from FEMA, from the federal government, which will guarantee an extra $300 for 3 weeks, so a total of $900, to Rhode Islanders receiving unemployment insurance benefits. So I want to be clear about this. This is temporary, and I'm calling on the Trump administration to do the right thing and make it permanent, or do something even more for the millions of Americans who are out of work. Having said that, it's good news. So we received word that we've been approved. The Department of Labor and Training is setting up a system to actually disperse the monies. We hope that that'll be ready in the next couple of weeks so that they'll be distributing the money. And I promise you we're going to do it as fast as possible. If it's ready in a week, it'll be a week. It's more likely 2 to 3 weeks because we have to set up a whole new system. But the bottom line is, this is good news. This is good news. So if you're out there and if you had been receiving the extra $600, which went away on August 1st, you are now going to get a one-time additional payment of $900. So it's not enough, but it's something. You ought to have it within the next 2 to 3 weeks. Department of Labor and Training is setting that up, and I hope the $900 can help you alleviate some of your concerns and pay some of your bills.